Good morning. In Module 3, we will explore today the Action Plan, a tool to aid the implementation of the Smart Family Intervention to support and empower families in promoting well-being and a healthy lifestyle. I am Maria Ramos, a PhD doctor and expert in health promotion and public health. We are implementing the Smart Family in the Balearic Islands, Spain. First, I will show you the index of the template that we have used for writing the action plan. It's a template provided by the Finnish team that coordinate this best action. Then we will go through each of the points. As you can see, this index is similar to those used for research projects, as it starts with a description of the problem and the area where you want to implement the intervention. Then the definition of the specific aims or objectives and the target population. The description of the actions you will take to achieve these objectives, the design of the evaluation, and the timeline. Childhood obesity is one of the greatest challenges in public health. In Balearic Islands, we conducted 2 studies of the prevalence of childhood obesity in 2005 and 2017. And we found that the prevalence of childhood obesity was higher in Eivissa than in the other islands. And one of the factors associated to it could be that most children went to school by car. In Spain, in primary health care, we have a free child and adolescent health program developed by nurses and pediatricians. So we decided to implement a Smart Family in primary health care in 3 health centers in Eivissa city, which is a city with high socioeconomic inequities, as you can see in the map. As you know, childhood obesity is not mainly due to individual factors, but to factors related to the social environment. In the Balearic Islands, we do not have a specific program for the prevention or treatment of childhood obesity. So primary healthcare professionals do what they can, and we don't know the results of these interventions, even though their perception is that these interventions are not effective. So the objectives of our pilot action plan were, first, to train a group of primary health professionals in the Smart Family model. Second, to design an intervention for the prevention and treatment of childhood overweight and obesity in primary health care based on the Smart Family model, but from the perspective of the social determinants of health. And third and fourth, to pilot this intervention in the Objective 3 for the treatment of childhood obesity and in the Objective 4 for the prevention of childhood obesity. Our target population was different for each objectives. In the first one, there were the pediatric nurses, 3 pediatric nurses of primary health care, and 3 pediatricians, although the pediatricians participate secondarily through the nurses. In the second objective, the entire population of the Balearic Islands, as this program, we want to extend it to all the islands. And in the third and fourth objectives, our target were families, in the first case with a son or daughter up to 14 years old with overweight or obesity, and in the second case without a family with a son or daughter without obesity, but with risk factors, especially that the mother has obesity and a basic educational level. We carefully define also inclusion and exclusion criteria. Here you can see our pilot team, local implementation group, the 3 nurses, the subdirector of primary healthcare in Eivissa, and on the right is you can see the Finnish team, our mentors with me. The island of Eivissa is mainly devoted to tourism and is a complex context with high rates of immigration, with high socioeconomic inequalities, and a significant housing problem, especially for temporary workers. At the same time, primary healthcare in Spain was one of the best in the world, but now is changing, somehow losing its essence. And in 2023, during the implementation of Smart Family, there were elections, the government shift to the right, and the primary healthcare directors and subdirectors changed. All these factors have influenced the Smart Family pilot in Eivissa. You can see the actions performed for each objective. For training the nurses, we follow the online platform provided by the Finnish team, but we also had 2 online mentoring sessions with them and weekly meetings, the local team. We selected 66 educational materials from the hundreds developed by the Smart Family project. We not only translate them, but also adapted them to our Mediterranean context. And then we designed the intervention. One important point is that organizational changes in the schedules of the pediatric nurses were necessary because the Smart Family is an intervention that requires more time than the 5 minutes of regular visits. And to get this was difficult. It was not easy to get this time from the subdirectors. Here you can see the design of the evaluation. We combine quantitative and qualitative methods. We used 2 questionnaires addressed to the professionals provided by the Finnish team, and we also designed a data collection notebook for the families. And we also plan open and in-depth interviews with the pediatric nurses, pediatricians, and the families, including their children. In the data collection notebook for families, we collect information about the social factors of the family's environment, as well as anthropometric measurements of the child and their parents. Therefore, we have to seek permission from the Balearic Islands Ethical Committee, and it also took time to correctly complete all the paperwork. For all these reasons, the pilot that was planned to begin in 2024 finally began at the beginning of 2025. This action plan has been essential in this limited time project to keep us on track and for communication between us in the local team, but also with the Balearic Island Health Services staff, with the Finnish team, and with other European partners. In our humble opinion, we recommend to use it, but be careful because paper holds everything, so it's easy to be too ambitious. And also because you will encounter unforeseen events that will force you to modify the plan of the schedule. Our final recommendation will be that before acting, it's essential to plan, before planning, it is essential to do a diagnosis of the situation, the basal situation. When you plan, try to be realistic and consider possible unforeseen events. And even considering unforeseen events, you will find them, so be prepared. Thanks for your attention.